So I think we can get started. This is a hybrid event, so there are a number of us here in the room, and there are a number of people online. So this is a new seminar series, a distinguished speaker series at the Hariri Institute that we are co-sponsoring with BU School of Public Health Population Health Data Science program, which is a new fantastic program that SPH has created, and also with the Center for Emerging Infectious Diseases Policy and Research, SEED. And I would like to thank particularly Laura White and Debbie Cheng for co-organizing the seminar series with us. And the seminar series is in fact focusing on predicting, preventing the next pandemic. We have all experienced what the effects of COVID-19 have been. And I think that it is a time where there are enough resources out there available, and there is an opportunity for thinking ahead before the next pandemic happens and comes, what we can do as a scientific community in order to develop tools that predict and prevent the next pandemic. And here at Boston University, we have a new program that is funded by the National Science Foundation with a large interdisciplinary team working on this very issue. So I'll introduce Laura. Laura White is a professor of biostatistics at the Boston University School of Public Health. Her group is working on statistical modeling to understand transmission dynamics for a variety of different diseases. So she has worked on COVID. She was part of the BU task force where they studied the spread of the epidemic within the BU campus. And she has also worked on, in general, public health surveillance systems, in a variety of different settings, including tuberculosis, hepatitis C, HIV, and substance use disorders. And she works also with the Boston Providence Center for AIDS Research. So with that, Laura, I will ask you to introduce our speaker today. Thank you.
Thanks, Giannis. It's a great pleasure to introduce our speaker for today, Dr. Mark Lurie from Brown University. Dr. Lurie is an infectious disease epidemiologist, professor of epidemiology at Brown University, and director of Brown's International Health Institute. He was actually an undergrad at BU, so it's nice to have him back on campus, and earned a master's in African history from the University of Florida, and then a PhD in international health from Johns Hopkins University. For more than 2 decades, his work has focused on human mobility and the HIV, TB, and HIV and TB in sub-Saharan Africa, which is where I first became aware of his work, since we share interest in TB research. So great to have that in connection as well. Now with the receipt of new NSF funding, which Brown also has a similar funding mechanism to BU for pandemic preparedness, he's turned a lot of his attention toward understanding mobility and social interaction as they pertain to infectious diseases. So I'm really pleased to have him here today talking about a very important topic, a very perplexing and challenging problem in infectious diseases of social mixing and mobility. I'll turn time over to you, Mark.
Thanks very much, everybody. Good afternoon. For those both who are online and present today, I really appreciate the opportunity to be here and to talk a little bit about our efforts at BU, similar to yours here in the realm of trying to predict and prevent future pandemics. However, I feel I would be remiss and probably regretful if I didn't use this opportunity to mention my time here as an undergrad at BU. Yep, that's me, the long-haired guy down there, under the tutelage of Howard Zinn, who's pictured somewhere else in there. Probably many of you are not around in these days, but this was days of lots of anti-apartheid activism. BU was one of many universities that had lots of investments in companies that were doing business in South Africa, and students those days were very active trying to get universities to divest. If you measure our success by how much we got BU to divest, we actually had a negative success. because during the time I was an undergrad, they actually doubled their investments in companies that did business in South Africa, while all other places were busy divesting and finding ways to oppose apartheid. As a native South African who had recently moved to this country, it was a role that I played outside of the classroom, and probably learned much more there than I did inside of the classroom. On graduation day, the chief of police there in the top left said, "Lurie, I'm glad you're out of here," which gave you a sense of how closely they watched some of us activists on campus. After all, we were taking over the library, we were protesting outside the president's office, we were setting up tented camps and the like. But it turns out in the end, we had the last word on the chief of police, because at graduation in the stadium, as President Silber was giving his speech, because only he could give a speech at graduation, we flew a helicopter, flew a plane over with a banner telling BU to divest. The whole stadium stood up and started clapping in the middle of his speech, and needless to say, Chief of Police was indeed very happy to get rid of me and my other cohorts. So imagine my surprise. A few years later, I suppose 6 or 7 years later, I found myself in a middle of a game park in South Africa, and I've been assigned the job of painting numbers on the side of a 1,900-pound Cape buffalo who had just been tranquilized and sedated. And other people were measuring his horns, some checked his dental health, examined his hoof, took samples, and did a whole workup on the whole buffalo herd to try to detect which of them were infected with TB. And bovine TB had been detected in buffaloes fairly recently in the 1990s, probably introduced by cattle to buffalo transmission, and eventually at this time had already now become endemic, with buffalo to buffalo transmission dominating. And the patterns of infection within the herds were curious, because what you would find is that most herds had absolutely no TB. And then occasional herds had very high levels of TB. And the link between them was very frequently a male buffalo who had been kicked out of the social circle and forced to find new friends amongst a different herd. And so acting as a super spreader, that those male buffalo were, if infected, very likely to infect large portions of the new herd where they were adapted. So my job then was writing numbers on the buffalo, and why was I doing that? Well, back then buffalo weren't yet wearing Fitbits and other tracking devices. They weren't carrying their iPhones around. So in a couple of days we had to recapture those buffalo, tranquilize those ones again who had been found to have TB, and then isolate them. So in effect what we were doing was the epidemiological equivalent of changing the social network in order to isolate those who are infected, change the probability that they would come in contact with uninfected animals, and therefore infect those animals. The obvious parallels to what we did at the early stages of COVID epidemic, where we enforced isolation and other measures of changing our social network, our social interaction, to try to slow the spread. So I'm not very good at painting, but I did learn to paint very quickly, because you didn't want to be around when the buffalo were starting to wake up. But my real work actually wasn't in wildlife. This was just a little side gig I was doing because I befriended a local vet who was responsible for some of the big animals in some of the game parks close to where we were living. My real work, though, was about humans and their mobility, and how that impacted the spread of HIV in South Africa, and the newly democratized South Africa in the mid-1990s, a place with deeply entrenched and racialized migrant labor system that was likely to be critical in the spread of HIV. And indeed, as a historian, I had learned that 100 years before, TB did something that I thought HIV would do in the 1990s, which is that the gold mines and other mining communities acted as hotspots for transmission, and the migrant labor system, which was so deeply entrenched a part of apartheid, forced people to live in certain areas, therefore migrating really frequently just at the end of the year back home and exposing their partners and their families to new infections that they hadn't seen before. And those were the patterns of transmission that largely described TB in the 1890s, soon after the discovery of gold and diamonds in South Africa, and again 100 years later of HIV, again spread from these hotspots of transmission to these rural areas very efficiently through a system of migrant labor, through people's movements across space and time. So that theme has become, for me, a kind of running theme through all of my work. And while my dissertation and my work since then has all been in sub-Saharan Africa trying to understand these dynamics, the COVID pandemic was really an opportunity to zoom out on that lens and to apply some of the lessons, some of the methodologies that we are developing in areas to allow us to measure people's mobility, their movement through space and time, and their interactions with one another. And so why are these things at all important? Why are we interested in measuring mobility and understanding how people interact? Just one or two very quick examples. This is one of the simplest and, for me, almost most elegant studies that I've seen that tells you a lot about human history and about why mobility is important. And it shows 4 generations of one family who are based in the northeast part of England. And what you see in the top left corner is the geographical footprint of, we'll call him the grandfather in this family. And you can see that for over his entire life, he moves about 10 kilometers west, 10 kilometers east, and 10 kilometers north of where he's based, right? So he's got a very small footprint. His son in panel B there makes it all the way down to London. His grandson is a European traveler, and his great-grandson, like all of us, is a world traveler. And that makes us part of an interconnected network where new pathogens can emerge in one place and quickly and very efficiently be transported to another place. And in fact, we've all witnessed that in real time in very unfortunate ways in the last couple of years. So with that bit of background, I want to talk a little bit about our center at Brown, which is focused on using information about mobility and social mixing to try to prevent and predict future pandemics. And for those of you who don't know, this was the call for proposals from the National Science Foundation that our colleagues here at BU also answered, and I think about 15, maybe 20 centers around the country have been funded on this mechanism. And the idea was, for me, the two things that were really unique about it was, firstly, was that the scope and the timeline. So the idea was to think kind of 5 or 10 years into the future about technologies, about methodologies, about information, about data that we might have that could put us on a better footing at that time to deal with what we all know will be a future pandemic, right? So what information, what data, what methodologies can we develop that we're going to be in a better position to address a pandemic early when it occurs? The other unique part about this, so that's the time frame, but the other unique part was the requirement of collaboration across very specific disciplines. And so the NSF specified that there needs to be people in mathematics, in engineering. There need to be people in computer science. So they were quite specific about some of the different disciplines that they wanted people to come at this set of questions. So a very unique opportunity to kind of conceptualize a long-term project with deep collaborations from people across different disciplines that you may ordinarily not have the opportunity to collaborate with. So given that, we started with a really, what I think is a very simple, even overly simplified set of premises that underlie our approach to what we wanted to contribute. And that is the first idea that very basically and very obviously that infectious diseases spread from human to human, right? So the way that we interact with others and the way that we move through space and time are going to be really important determinants of the potential of a new pandemic to establish itself and spread through a new population. So if we have intimate details about the way that people move, about the way that we interact, then we're potentially in a better position to implement interventions that focus on the behaviors that are conducive to spread, while leaving alone the behaviors that are not necessarily conducive to spread. So again, going back to where we were at the beginning of the pandemic, my argument is that because we didn't know as much as we could have about how people interacted, we came with a hammer approach and we said, let's eliminate all interaction. Whereas we learned actually that many kinds of interactions are actually fairly safe, right? Whether they're outside or with a small number of people or whether they're masked or depending on the environment, right? So with more information, with more data, I think we're going to be in a better position to make more refined choices in our implementation of interventions that are likely to be more successful. When I think of this problem from an epidemiological perspective, this is the way that I tend to think about the importance of the mixing part, and that is to go back to a kind of basic concept in epidemiology, which I'm sure people are familiar with now, and if they weren't before the pandemic, they certainly are now, because it's really, at least at one point, became popularized in the press, and you could find all kinds of articles in the New York Times about how we calculate R naught and what it means and how we interpret it. But the basic idea is that it measures on average how many new infections will occur in when a primary case is introduced into a population that's totally susceptible, okay? So think about that moment of human to human transmission very early on, where the entire population is susceptible. Nobody's had COVID yet. There's no vaccines. So everyone is susceptible. And then theoretically, we're asking the question, on average, how many people is that infected person likely to infect? And if that number is really, really high, that means the epidemic or pandemic is going to grow really quickly. If that number is below 1, it means that on average, a new infected person only infects less than one other person, and then you're going to have a decrease. The epidemic is eventually going to die out or fade out. So what are the things that underlie or determine this R naught? It's really determined by three things. The first is how infectious an agent is, right? So how likely is transmission to occur when an infected person comes in contact with an uninfected person? It's the duration of the infectious period, right? Is it something like HIV, where potentially you're infectious for many, many years, or something like COVID, where probably the infectious period is more in the days to weeks kind of zone? And finally, the last piece that's going to determine epidemic potential is how frequently people who are infected come in contact with uninfected people. And that's really our pattern of mixing, our social network. And that's really where we're focusing our work in our MAPS project. And another way to think about it is that the other two variables here are largely biological variables, right? Those things are going to be determined by the specificities of the new virus or whatever it is, the new pathogen that emerges. That's going to largely determine its biological capabilities and its transmission probabilities. But it's the one that we're interested in is really guided by human behavior, right? It's our choices, our decisions about who we interact with. And so in some ways, I think in some ways it's more amenable to change. But that's, in a way, I hope, conceptually an idea of why it is that we're focusing on social mixing and interaction as a way to better situate us to address future pandemics. So I think I've given you already quite a bit about the rationale for maps and why we focus in the way we do. I'm going to make a few comments about measuring context and the complexity of that and what we mean by context specifically. And then I'm going to talk about the different components of our project and specifically about one aspect that's a kind of overarching proof of concept where we're trying to apply many of the different aspects of the project to one particular sort of sub-project, if you like. So what do we mean by a contact? So a contact is something that is probably likely to depend on highly depend on the characteristics of the pathogen, right? So if we're talking about a pathogen that's sexually transmitted, then we're going to want to know about people's sexual networks and who interacts with whom in those kinds of areas. So the pathogen is largely going to determine how we define what a contact is. But at least we can think about these sort of basic features that we would want to try to enumerate or quantify. Who is the contact with? How long does it occur? At what distance does it happen? Is it occurring? What kind of activity is it? Is it in a place where people are passively sitting in a room versus, let's say, a gym where people are exercising, potentially breathing more on each other? What's the environment like, right? Is there proper circulation within the room? All of these things are going to be ways of measuring a contact that are important for potential transmission. And then there are all kinds of other behaviors as well that we might think about measuring, whether people are masked or not, whether people have been inoculated or vaccinated. So these are going to be also really important determinants of transmission and part of how we think about contacts and who we come in contact with. If you'll excuse me for a moment with a borrowed slide, I think it's worth saying that across humans, we are in, there's a spectrum of behavior. Some of us love human contact, others find it completely repulsive, and somewhere in the middle is probably most of us. But because of the fact that it varies by people, makes it interesting and worthwhile studying scientifically. It's also worth saying that our behavior has probably changed considerably during and given the pandemic. So here's the Director General of the WHO, and for those that can't read it, I couldn't resist. His T-shirt says, "When this virus is over, I still want some of you to stay away from me." I can really identify with that, but more importantly, it makes the point that actually some of our behaviors have actually changed as a result of the pandemic itself. So we're not just interested in measuring a kind of baseline behaviors of how we used to interact, if you like, before the pandemic came, but also keeping in mind that the pandemic and a whole variety of other things that were related to that actually influence our behavior as well. Again, the part of that being that behavior changes over time. If we're measuring people's contacts, it's not just who we had contact with in this room over 1 hour, but it's really about your week or your lifetime or a month's worth of contact that you had and that people who you had contact with had, et cetera, et cetera. Some of the interesting studies that have been done give us some data about how we mix and who we mix and some of the patterns of mixing, but they also expose some of the methodological problems inherent in some of these studies, and in particular the fact that very frequently we're talking about data that's self-report, right? It can be very difficult to recall how many people you interacted with, under what kinds of circumstances, if you're talking about maybe 2, 3, or 4 days before. So as a result, the recall period tends to be very, very short. And we frequently miss, any kind of like longitudinal effect where people's behavior might actually change over time. A further weakness is that most of these surveys, and this is a systematic review from prior to COVID, but most of them, I think about 80% of them were conducted in high-income countries. So we have starting to get some data from some places, but in the usual way, it's the wealthier countries that are much better represented. This is a rather busy slide, but just to show some ways that people are measuring mixing. So on the left side here, these violin plots, this is a national probability sample from almost 5,000 households in the United States, where they collected information on social contact patterns. This is during COVID. The small dot over there is the average number of contacts per person in that category. And some of the things that you see that are interesting is that on average, people in lower socioeconomic status tend to have more contacts than people in higher socioeconomic status. Again, this is during COVID and close to the beginning of COVID, so probably a lot of that has to do with people in those income levels being service workers who were much more likely to stay actively working and therefore interacting with more people than other folks who were wealthier and in jobs that allowed them to work at home. We also see that men slightly more social interactions than do women, and that older people there in the top left tend to have the smallest number, a kind of shrinking number of social contacts over time. On the right-hand side, this is a systematic review and meta-analysis of a whole bunch of surveys conducted in Europe showing where most of the contacts happen, and you can see in the young age groups, school makes up a vast majority of where those things happen, and then as you get to the older age groups, work and family make up the majority of contacts that people have. This is a study from 8 European countries where they asked people to fill out a diary. So that's a very common methodology that's used in these kinds of studies. They asked people to record their physical and non-physical contacts, again, just for one single day. And you can see various patterns of mixing here. For instance, that diagonal line here shows people mixing with like people. So people mixing with their same age groups over the course of their lifetimes. Over here on the left side, you have people mixing with younger people, so adults in their 40s with children, tending to mix with younger people. And then on the right side there in Britain, you see a kind of plateau where in the working years, many of the interactions that you have are with people of a similar age group. Just one or two other quick examples of ways that we think about measuring people's interactions. So this is a really interesting study done in Surrey in England, where they asked people they asked about 500 volunteers, which turned out to be about 5% of the total population of one town, to use a mobile phone app to track people they interacted with. And one of the important things that they found was that they did it over a 3-day period. At the beginning, during work days, people had very few interactions, but then on the weekends, there were a huge increase in the number of interactions that people had. Again, pointing out some of the complexities of measuring these kinds of behaviors that change over time that may have seasonal effects, or in this case, weekend effects, where people all went in this town to watch the local football game. So that was a place of lots and lots of mixing over the weekend. Of course, it's also worth keeping in mind that a lot of these things nowadays are somewhat readily measured by devices that we're all already carrying in our pockets or potentially wearing. For those without good eyesight, a few people are running away from an attacking monster, and a woman's looking at her watch and says, "Oh, I actually do want to log this as a workout." So we do have these devices. They're becoming more sophisticated. They're allowing us to monitor all kinds of things from not only the number of steps we take, but the quality of sleep that we get, potentially body temperature, aspiration, all kinds of other things that could potentially be early signs or early warning signs. Finally, we've been experimenting with deploying phone-based apps to track people's mobility, their kind of geographical footprint. And this is an early example from some work with TB patients who are just initiating treatment in South Africa. They're getting a cell phone as part of an intervention to help them adhere to treatment. And on the cell phone is an app that follows, that uses GPS to track their essentially all of their movements. So we're starting to get more and more information. Just again, to sum up some of the problems is that we often don't have longitudinal data, we often don't have objective measures, and recall is really, really complicated. And so we could potentially go a long way by developing new devices, new methodologies that could measure some of these interactions and movements in a more objective way. So with that, I want to turn now to talking about our MAPS project, and particularly some of the main components, as hopefully I've set the stage for the rationale for why mobility and social mixing is important. And when the NSF put out this call, they asked us to articulate what they called a grand challenge, which was this 5-year kind of vision about what it is that we wanted to address. And so it won't come as a surprise when I read this to you that for us it was all focused on mobility and population mixing. And so we asked the question, how can we best use data on mobility and population mixing to inform real-time pandemic responses across a range of pathogens under conditions of uncertainty while balancing benefits, risks, and harms, right? It's a lot of stuff. It's a lot of little sub-sentences there. But in essence, we're trying to make the most of available and generate our own data on mixing and mobility and use that to make informed policy decisions that are also ethical. So how do we do that? We focus on 4 main areas shown here, and I'll just talk about each of them very briefly. On the data side, we recognize, as my talk I think has already confirmed, that there's already significant amount of data out there already. What we think is missing is a way of bringing that together in one organized place for researchers to access in real time. So we're trying to be a kind of a curator of studies of this type that have been measuring people's social mixing and putting that all in one place for researchers to be able to access as they are asking their own questions about pandemic prevention and prediction. So we're trying to, again, just create a kind of library of available data on mixing and mobility. Our second piece is around devices, and this is where the engineers come in. As I've mentioned already, there's, I think, a lot of potential for advancing science when we have devices that are wearable and that are able to measure things much more accurately and much more objectively. So we're looking actively into phone apps, potentially wearables. In the long-term future, we might even be looking at things that are able to measure various biometrics as well. But for now, we're focusing on the areas of mobility and social mixing, and I'll get back to that in just a minute. A lot of the work then, a lot of the data that we generate and that we collect from other folks who have generated this data then is hopefully to be made available for modelers who are interested in trying to predict and prevent future pandemics. I think to this audience, I probably don't need to make an argument about how modeling has become a really important policy tool. In many ways, it underlay our response to the pandemic at various critically important junctures. And so what we're trying to do in this scope of work is to develop a menu of models, probably 3 or 4 different models that vary in their complexity, but that take the most advantage that we can of the different levels of mobility and mixing data that we may have. So we're trying to have some models that are, in a way, sort of bare bones, ready to be adapted to a new pathogen as it emerges, given the information that we know and hopefully will know and generate about how people interact, about those social networks. Finally, although I don't think of it as a separate feature, is the obvious notion that in the kinds of data that we're talking about collecting, inherent to that are all kinds of issues about confidentiality, about privacy, about ethics, about how you use that data in an ethical way without revealing personal identifying information. And so we've spent and invested a lot of time with people in ethics and bioethics and other areas to help us think through a kind of framework about how we can handle the kinds of data that we're planning to collect in a ethically and responsible way. So those are the main components of our project, and now I just want to talk just for a couple of minutes about one sort of applied project within our maps that is really taking all of these components and combining them in a kind of real-life exercise. And what we're trying to do here, we're calling it mapping at Brown, but the basic idea is that we want to map the entire social network at the university. So we've been working hard on developing a phone-based app that uses Bluetooth. So imagine if we did this here at BU, all of you a few days ago signed up for this new app, you downloaded it. The app would be able to tell that we were all in the same room for about an hour, that some of us were sitting closer to each other, so it could tell not only our presence within the room, but also our proximity to other people in the room. And then as you go about your day, you're going to be interacting with other people, they're going to be interacting with other people. You put all of that information together and you get a kind of map of the whole social network. It tells you who interacts with who, under what circumstances, what are the age mixing patterns of people that are interacting, what are the patterns between students and faculty, between faculty and staff, between anybody that is sort of contained in that database. That information then can be useful for a bunch of things, and our idea is that once we've mapped the social network, it allows us to ask all kinds of questions about what kinds of interventions might be feasible and slow the spread of a new epidemic in this particular social setting, which in this case is a Brown University, right? We can then, in the next phase, what we'll do is introduce a virtual pathogen into the network, okay? Nobody's ever going to get infected, but on a computer, we're going to introduce a pathogen, seed it maybe in 3 or 4 different random people in the population, and then we're going to watch how that grows and spreads through the network based on the social interactions that people are having. That allows us to then ask the what if question, which is, well, what if the social networks were different, right? So what interventions then could we have, given this new pathogen and given the way that people are interacting, that we could change those social interactions in a way that were conducive to slowing the spread of the disease, right? So in a school setting, that might be, well, maybe in the cafeteria, we only let 10 people in at a time. Or maybe class size, there's a certain density that you can calculate of, based on the space, the size of the room and the number of people in there. So there are different ways of thinking about ways of changing the social network, people's social interactions that could be conducive to slowing the spread of new infections. So we're investing a lot of time in this. We have prototypes of the app. What we've decided actually, the initial idea was this kind of grand, beautiful idea with this, really cool graphics and interactive components and ways of reminding people to become involved and potentially rewarding them for being involved, all kinds of things that you can imagine you can integrate into an app like that. Reality has struck. We're on a short timeline with a small budget, so we're really focused down a lot just on the very basic measures of what it is that we really require. So we're using little Bluetooth beacons. They're about the size of a matchbox. In this room, we'd probably put about 3 or 4 of them, and then people will sign up for the app and the beacon will communicate. That information will be sent to us for our analysis. As you can imagine, a lot of the work, not only the sort of technical development of that, but a lot of it is about kind of understanding how, in this case, the users or the community, who I conceive of as initially everybody in our School of Public Health, so the person who sits at the front desk, people who deliver things in and out of the building, students, staff, faculty, everybody who populates that building is part of our community. And so we've had already lots of conversations about what this might look like and how people might feel about this and whether or not they want to be tracked and how they want to be tracked and what kinds of questions they have about where the data goes and who has access to the data and whether it could be used for nefarious purposes. So of course, all of these kinds of issues come up, and we're really just trying to confront them head on by having this open conversation across the school, across the university, where we're really getting deep into what our thoughts are about how we'll handle the data in an ethical way, but also getting a lot of feedback from people about what they'd be comfortable with. And maybe just a small anecdote, and what's been very interesting to me is I thought students in particular would be quite reluctant to embrace this, and our experience has been quite the opposite, and a lot of the reaction is, hey, we know we're tracked all the time, right? We know Amazon is tracking us, Netflix is tracking us, right? It's happening all the time. So we're not actually that worried about that because here's a place where instead of using it for nefarious or marketing purposes, you might actually use that data for good. So it's been very interesting to me. I've been to a number of very large classes where I've talked to people about it. Just like a 15-minute spiel, this is what we're trying to do, this is what it would mean for you. And then I say, how many people are interested in participating right now? They're totally comfortable, they don't have any ethical concerns. About 85% of the hands go up. No problem, they're ready to be a part of it. I say, how many people are on the fence? Depending on how, the details about how we deal with the data, you may go either way. You get 10% of people. And then there's 5% of people who say, forget it, I'm never going to do it regardless of how you're handling the data. I just don't want to be a part of that. So it's been really, really interesting. I would have thought, firstly, that we would have had a lot more refusals. We haven't actually implemented it, right? This is just, I would participate versus actually participating might be a different thing. So we'll wait till the fall when we actually implement it and see how ready people are to be involved in this kind of research. So given time, I think I'm going to stop right there. Hopefully I've given you a good sense of what our project is about, some of the ethical and technical issues that we're already starting to confront. And just close by saying again, thank you again for having me to have this opportunity to interact with other people who are funded under the same mechanism. All of us are looking forward to the next phase where we're told we're going to get competitive. We're going to be applying for what sounds like quite a large pot of money to really allow some of our dreams to actually come true, and to have an opportunity to talk to you guys about what you're thinking and to strategize about potential ways that we could collaborate is really great. So thanks, everybody. I hope you've enjoyed the talk, and I'm happy to answer any questions.
So you mentioned having visibility into contacts, and that could inform decisions and even inform policies that may control the spread of an epidemic. Do you have a sense of what happens after that point and how these policies are designed? Is that an interesting question to consider?
So you're talking about sort of long-term impacts of these policies and potentially, people.
But even the nitty-gritty details on how you develop. So if I'm a policymaker, I have visibility. I understand how it is spreading. How do I decide whether I need to instruct people to wear masks? Or how do I decide? And what are the various forms of intervention, and how to, as a policymaker, decide what is the right mix of policies, control mechanisms that I could deploy? Would those be uniform? Would those depend on the community? So that policy design space is where I'm asking.
Yeah, thank you. That's a really, really good question. Right now, to be honest, it has not been an area of focus, but I've very much identified it as something for our phase 2. I think to be able to have connections to policymakers so that our modeling and their policy questions are integrated, that they can help us identify what some of the questions are that we might be able to model. I'm looking at that kind of arrangement. So recently at Brown, Jennifer Nuzzo, who's probably known to many of you, has opened a new pandemic center, and she focuses a lot on policy. They've got an office in Washington and a lot of interaction between lawmakers and academics through their kind of center in service of a dialogue that may be able to identify some of these questions. So I don't know the answer to any of those questions, only to say it's a great question and very much one of the areas for phase 2 that we're looking to expand, because I think if you do have that direct connection, then you're more likely to succeed, because you're asking questions, you're pushing the science in a direction that potentially policy could go, depending on the answers to those questions. So, yeah, thank you.
Yeah, thanks for a really interesting talk. I have a few questions, but one maybe to start out. I'm curious how you think about adapting your co-location data that you're collecting to different pathogens. You've mentioned sort of the type of interactions matter. Different pathogens might be different.
Yeah, so we've had a really interesting discussion in our group about, do we want to focus on one particular pathogen or one particular type of transmission? And my response to that is, I want to be as open as possible. I want to measure the whole range of people's interactions. I don't want to predefine them by some epidemiological criteria. I want the whole range of them, and then later I can say, well, these are the ones that are important to this pathogen, these are the ones that are important to that pathogen. So we've had a lot of discussion about how you do that and how you measure that. Another interesting aspect of that is initially we conceived of transmission as pretty much direct transmission. So if we're measuring people's proximity, that's a way of saying you and I were close enough, depending on the pathogen, let's just say, that we were 5 minutes together in a closed environment, et cetera, and transmission may occur there. There's another kind of transmission that could happen, which is that all of us in this room here, let's just say one of us or several of us maybe have whatever, we'll call it COVID, right? And then we leave this room, and we actually don't have any direct contact with the next group of people who are coming in, but in a way the room is charged, and the next group of people could potentially get infected even though they had no direct contact with us. So initially we were thinking, well, it's just about direct contact, but then we started thinking about this more complex one. So then it's about like measuring who was, in various spaces at various times, even if they didn't have direct interaction. So again, I think my instinct is to not limit that by saying, oh, we're only, because COVID only spreads, under these conditions, we're only interested in those kinds of interactions. That, I think, is short-sighted. I think we want to know all the interactions, because the next COVID or the next whatever it is going to have slightly different, kind of mechanisms of spread. So if we know what those interactions are, then we're pointing in the right direction. That's the hope.
Yeah, thanks.
I was just wondering, how representative do you think your participants have to be of the population overall for it to be as successful in terms of modeling?
Yeah.
What if all the students sign up, but none of the faculty sign up? Or, I don't know.
Okay, so there's that also, and then there's a broader question of how representative is this, Ivy League school,
Right.
whatever, in the Northeast. So my answer to that is, not at all. I mean, it's probably representative of some other, large schools in the Northeast, that have similar demographics. But you're right. The way that people interact, let's just say in the Brown environment, may have some similarities to other places, but it's not going to be the same as how people interact, let's say, on a cruise ship or in a long-term care facility for the elderly, or, any of a number of other, in an office setting. So I think what we're trying to do then, and a lot of our focus for phase 2, is to try to collect as much information about interactions in all of those different settings. So yes, even if we are able to get, let's say, everybody at Brown campus to sign up, that's great. It's highly representative of Brown, but how representative is that of other places? And again, I think I've answered that question somewhat. But I think the solution to that is not to say, well, we shouldn't study it because it's not representative. To say, well, we can learn a lot from that, but we need to shine that same light in a lot of different environments to understand what kinds of patterns are going on in all of those places. And so in a way, that's like our vision for the next phase, is to really understand in these specific settings, and then start to like connect those settings as well. That's the next kind of conceptual step.
Thank you, Mark, for a great talk. It was very interesting. My question is related to the last question, and I appreciate the efforts you've put into concern about ethics of data privacy. And I'm curious, most of this is an opt-in process, right?
Definitely.
Students and people have to opt in, it's not an opt-out.
It's only an opt-in.
And I wonder, and it's related to the representation of the data, if you've considered ways to augment the data through public data, social media data, where you can perhaps, people often disclose a location, or you could use, computer vision to identify landmarks, because a lot of times people are posting in public places, and if that is an area you've considered to augment the data you would get from wearables and mobile phones?
That's a really, really interesting question. Right now, we're not doing anything in that space, but I could see that we could. One area that I think falls within the realm of what you're asking is passive data that's collected at the university. So I don't know about here, but at Brown, you got to swipe everywhere you go. You get in an elevator, you get in a new building, and all of that data is collected by the university. They actually have all of that. They know who it is. They know where you swiped and when. Similarly, every time you log onto Wi-Fi, same thing. So there's quite a lot of information already being collected, not to mention all the stuff that we're posting ourselves about ourselves. Our response to that has been to be very cautious, because I never want students or anybody to feel like we're spying on them or doing anything nefarious. And at Brown, and I'm sure it happened at many other places, that passive data was actually used during the pandemic to send letters to students to say, hey, we saw you were in this building and you weren't supposed to be there. So people didn't know that they were being monitored in that way, and they sure didn't like getting a letter, that felt a lot like they were being spied on. So we're very careful not to ever, touch that data, to make sure that, it's got nothing to do with us. We didn't collect it. We're not analyzing it. But I am aware that, in a way, it's a kind of an incredible data source, because in some ways it's a higher level of detail than some of the things that we would collect. But I think, a lot of what we're trying to do is based on trust. And as soon as, students or anyone who we're trying to get to voluntarily be a part of this, feels like there's a nefarious aspect of it, or you didn't tell me you were doing that, then it's complete bust for us. So we're really, really careful about that, but at the same time, aware that there's almost like this gold mine there that could be really, really interesting. But I couldn't see a way that we would actually want to link that to individuals, just because of part of the history of that and the way that it was collected. I suppose at some point we might have all signed up for, the stuff being recorded, but it's not, not like in a study where you're literally going to consent to, A, B, C, and D. So it's arguable whether, as Brown employees and staff and faculty, we actually consented to whether they're going to collect that information. So I'm very, very careful about that, but also kind of intrigued about its possibilities.
Any other questions? We have no questions online.
Great. Well, if we don't have any other questions, I want to give another thank you to Mark for a really great talk, visiting us today. And also just want to make you aware of a few upcoming events. This is the first in a series of talks. So we have another event on May 2nd with John Drake of University of Georgia. And then on May 5th, So John's event will be hybrid. He'll be here in person, as well as streaming. And then we'll have an all-virtual event on May 5th with Lauren Ansel-Myers. So encourage you and invite you to participate in those events as well. And also note we're co-hosting with the Population Health Data Science program, as well as Lurie, another event on June 1st with Rafael Irizarry from Harvard, talking about data science. So find all of that online. But thanks everybody for your participation.